Choice Home Care and Hospice present Choices to Benefit the Aging with your host, Joe Urrutia.
Welcome to Choices to Benefit the Aging. I'm Joe Urrutia, Community Senior Service Coordinator for Choice Hospice and Home Health. Today's topic is prediabetic and hypertension. Our guest today is Dr. Hedarian, Mina Hedarian. Welcome to our program, Dr.
Thank you
Hedarian.
very much for inviting me to your show.
Thank you, Dr. Hedarian. Dr. Hedarian, what is your specialty?
My specialty is family practice. I'm a board certified family practice. Family practice encompasses all ages, starting from infant, born as a newborn, till adult and geriatric. I provide adult and adult medicine and women's care, pediatric, adolescent. In my office, I have a lab on site, and we do minor procedure, minor surgeries, and so, yeah.
Where is your office located?
My office is located on 6604 West Wynn. It's on the west side, on the corner of West Wynn and Escondida.
And your telephone number?
915-845-4600.
I was going to ask you, Dr. Hedarian, where did you get your training?
My training, I finished my residency in family practice in Charlton Methodist Hospital, which is affiliated to the Southwestern Medical Health Center in Dallas. And it's a 3-year program.
Where did you practice before moving to El Paso?
I was practicing in Albuquerque. I was working for Presbyterian Hospital and for 15 years. I was the lead physician there, and I was member of the part of the board physician management group there.
Why did you get into medical in this medical position as a physician?
Well, I was interested in medicine as early ages of my childhood. I was interested in science and chemistry, and my mother was a provider and a caregiver of the whole family, and her father was a physician, so she learned naturally how to take care of people. So everybody in the family, if they had any medical question or anything, they would come to her, and she would treat minor things. And so I was interested from childhood, and when I came to United States, I studied chemistry and biology, and then went to medical school.
So she inspired you in that to
Yes.
get into medicine?
Yes.
Okay. What made you move to El Paso? And moving into El Paso, you coming from Albuquerque, and I'm sure you worked in other cities. How do you find El Paso unique?
You know, I like El Paso. The community is very, the people are very nice, and I moved because of my family. My mother lives here, and my brothers, they live here. I decided to come here, and there was a need for a physician here, and I thought to bring my skill here so that I can serve the community.
What services do you provide at your clinic?
Adult medicine, which it includes from up to geriatric, old age, and we provide pediatric, adolescent, teenagers, and then also we provide women's care. We do PAP and physical, and also we have a lab on site that we can do certain labs to immediately find out about, like if you have diabetes, if you have any other health problem. And also we do minor procedure in the office.
As a matter of fact, I went by your office today, and I kind of liked it because of the location of it. You're like in the west side, in the middle of West Wynn, and usually people in that community tend to have to drive into central El Paso, and to have a physician in that area I thought was pretty awesome. You know, now people have something close to within their neighborhoods. So
when I came to El Paso, I looked around, where should I have my office? I saw the need that you need to have a neighborhood clinic, so people don't have to drive 20 minutes in a traffic to get to see their physician. So I put that office there so they can come. If they need to see me, I can provide that care within a day or the next day, today or the next day, they can come and see me.
Well, it was just kind of awesome to see a clinic, like you said, in a neighborhood setting where people, they don't really have to leave their community, and it's just right there in the convenience. I want to start talking about the diagnostic of the criteria for diabetics. Can you go a little bit more into that?
Well, when I moved to El Paso, I noticed that there is increased risk of diabetes, pre-diabetic, before becoming diabetes. Patients, they come with some vague symptoms, and when I interview them, then I do the proper testing, and I find pre-diabetic is very prominent in everywhere, but El Paso a lot too. Yes, in the community.
What is the criteria for pre-diabetic?
The pre-diabetic criteria is abdominal obesity. For men, you measure their waist circumference. If for men is more than 40 inch, and for women more than 35, and fasting blood sugar more than 110, and blood pressure of 130 over 85. And these other criteria that I'm saying, indicating it's one of the components of metabolic syndrome. That is a new syndrome that it increases the risk of cardiovascular symptoms like coronary artery disease, heart attack. So like elevated blood pressure more than 130 over 85, low HDL, which is a good cholesterol that protects your heart from having heart disease. And if your low HDL is less than 40 for men and less than 50 for women, that's a concern. Or triglyceride, which it is, if it is more than 150, that would be a concern.
So you're looking at triglyceride levels, the blood pressure. That's something very interesting that you said that's also can be a factor, the blood pressure that can show pre-diagnostic of diabetes. And also you mentioned earlier the cholesterol. So
well,
all these are factors?
There are diagnostic criteria for metabolic syndrome.
And what is metabolic syndrome to the public?
Metabolic syndrome, it's a new, it's called syndrome of X previously, or it's a combination of all these borderline diseases.
Okay.
Like if you have borderline hypertension, borderline diabetes, and obesity, like if overweight, those are like they can become diabetes. Like if you're overweight, then you have pre-diabetic, then it leads to diabetes.
Okay. What treatment and modalities should be founded for these type of diagnoses?
If you're diagnosed with pre-diabetic, initially the important thing is to do lifestyle changes. Usually physician, as soon as they find out that you have either borderline hypertension or pre-diabetic, the first choice or first step treatment is to give a chance to patient to go on exercise, change their dietary habit. It's a lifestyle change. It's something that has to be done till the rest of their life. It's not something that you do for 1 year or 1 month. It's something that you have to change. You have to make it change. You have to make an effort to change your diet and exercise daily. Daily exercise should be part of your routine daily living activities.
So it can be managed through exercise, through proper eating habits. Stress, is that also, would you consider that a factor?
Oh yes, definitely. Stress, it has shown that if you have diabetes, stress can increase your sugar level. So it's important for you to decrease your stress level. And yes, initially diet and exercise is important, and we give chance to patients like about 3 to 6 months to help them and see what they are eating, to bring a diary of their food and what type of activities they are doing, and we go over all those what they have done, and then we can help them, coach them. So what to eat, like carbohydrate, I recommend patient to eat 40 grams of carb per meal. So you count your carb. And everything I say it has, the only thing that does not have carb is protein, like fish, chicken, and meat. Rest of our egg and
what is a good carb and versus not a bad carb?
So there are two types of carbs. I call them good carb and bad carb. The good carbs are fruits and vegetables, and the bad carb, I call it the white bread, rice, pasta. But if you have a little bit of that, but preferable to have the whole grain, that like brown rice and multi-grain bread. If you have that, it's better. And then also, it's portion control. The size of the food, the size is very important as far as how much you eat. If you eat healthy food, but if you eat one whole cantaloupe or 1 pound of grape, yes, it is healthy, but it is not good for you because it has a lot of sugar. So a lot of people, they come and say they drink juices, orange juice for breakfast, or they have fruits and vegetable all day long, or carrots. Carrots is like 4 little carrot has 20 grams of carbohydrate, and that's equivalent to a piece of cake. So if you are having some healthy food, but then you have to choose the small portion. Like I say, about 3 to 4 ounces of protein, like fish or chicken. As far as carbohydrate, you can count your carb. There are books available at Barnes & Noble or other bookstore, or you can borrow books to learn how to count your carbs, or how to count the cholesterol, how much of cholesterol each food has. So like tomato has 6 grams of carb, and cucumber has 2 to 4 grams of carb.
So you're talking about vegetables, and a lot of people think, oh, I'm going to eat vegetables and that's going to help me with my diet. But you're even, from what I'm hearing, is that you're also saying, you know what, yes, eat vegetables and your fruits, but also you need to have a portion control on the intake. Is that correct?
That's correct.
Because of the sugar
exactly,
intake.
yes.
Okay.
Because all of that, it converts into sugar, and then excess sugar converts into triglyceride. Excess triglyceride in the liver, through some enzyme, it converts into cholesterol and bad cholesterol. So then it creates risk for diabetes, for heart disease, coronary artery disease. So when you have diabetes, diabetes is it's an independent risk factor for coronary artery disease.
I was going to ask you something about, as far as you were talking about food portion control, especially when we go out to dinner nowadays. If you look at what they bring to the table, it's actually, you can feed 2-3 people out of that. And do you agree with me? I have a tendency sometimes when I do go out, if I'm looking, watching out for my weight, I'll cut my meal in half and put it in to take out, and that just leave. Just cut. Is that safe to do?
Oh yes, definitely. Even though that portion of food, it can feed 3 or 4, because 3 ounces of meat, you always look at the size of the meat and make sure that you eat 3 ounces of the meat, and make sure you have a equivalent to 1/4 of a cup, about the size of a golf ball, like pasta or rice. And as far as the vegetable, about half a cup, which I would say about the size of a tennis ball or less than that, to have green vegetable. And bowl of salad, that would be sufficient. That should be the portion, how to eat. And I find in our society and our community here in America, our portion are large, and so it's